Welcome to the last episode of the 2022 Queensland RMO campaign webinar series, General Surgery Training. It's great to see so many enthusiastic doctors across Australia joining us in this event. My name is Andrea Muller and I'm the Northern Queensland Regional Training Hub's Program Manager. Today I'll be the moderator of this webinar. I would like to start by acknowledging the traditional custodians of the land of which we live and work and pay our deepest respects to their elders, ancestors and future generations. The Northern Queensland Regional Training Hubs is proud to be hosting this event, but it could not be made possible. And I've just lost, could not have been made possible without the Commonwealth Department of Health, who fund the Regional Training Hub program. Additionally, this was only possible through the collaboration and support of the Queensland Health Recruitment Team, James Cook University, and the doctors from Cairns, Mackay and Townsville hospitals. We have an exciting program ahead tonight. Firstly, we'll hear from Dr. Angela Robson, who is the SET Training Supervisor in Cairns Hospital, and she will update us about the general surgery training pathway and the application process. Following this, each of the Northern Queensland hospitals will have time to present their facilities and what you can expect as registrars and junior doctors there. So firstly, can we please welcome Dr. Angela Robson.
Okay, thanks for joining us. So if we go to the first slide, I'm as they said, I'm one of the general surgeons in Cairns, and I'm one of the SET supervisors for Cairns. And so we'll go through the entry requirements. Now it's fairly set out fairly well on the Royal, the RAC's website, but in the very first entry requirements are that you have to be either a permanent citizen of New Zealand or Australia or a citizen. Obviously, you need general medical registration, so you've got to finish your intern year, and they like you to actually have 2 years out of medical school before actually applying. Then there's a few other little courses, that online learning modules that you need to complete. And then it goes in, and that's all fairly generic for most, even the subspecialties, but also for general surgery. So if we go to the next slide, it gets a little bit more, we'll get more into the actual general surgical side of things. So obviously you have to apply to the college to get onto the surgical training program, but then it's within Queensland, you get offered places at training hospitals. So obviously we're talking the Northern Hub, the main ones, obviously Cairns, Townsville, Mackay. You would be placed, but you can be placed throughout Queensland for all of your training. Slightly different from next year, we have it's sort of gone in a full circle. We used to be a 5-year program, then a 4-year program. We're going back to a 5-year program, and it's going to be called GSET, and it'll be GSET 1 to 5. And that's all allocated your training hospitals through RACs, and you will train throughout Queensland. So once you apply to RACs, and if you get on, then every year they place you, but you still have to ask for a job through Queensland House as well, just to make things slightly confusing. All right, so the next slide for us will show the minimum requirements. So before you can even apply, you need the clinical rotation, so at least 26 weeks in general surgery rotations, and a minimum of 8 weeks in any critical care rotation, so things like ICU, a trauma unit, ED. Most people get an ICU term, which is good. There's a procedural skills form that you have to get ticked off, and the general surgery specific or science examination, so the GSSE, you have to pass, and there are a few pass rates over the few years, and a reasonable amount of people will pass on the first attempt, which is good. They have brought in this situational judgment test you have to do, but it sort of doesn't, at the marks at the moment, it's sort of a bit like a pilot they've brought in to try and work out if you're suited to surgery. Next slide will then cut us down. So once if you've met those requirements, you may be offered an interview. So overall, the actual selection process will be based on your CV, your referees, and your interview score. Obviously, they have different weights that you can see there. So the CV is 35%, referees are 25%, and the interview scores are a reasonable amount. Now, in the CV, it's very well set out in the fact that you have to get certain amount of points, and obviously the more points that you can get, the higher you get on your CV. So obviously there's the surgical experience. So each 8-week term you do counts for 2 points. Only can use the one term once. If you come rural or remote as like a PHO job, which is good for us in Cairns to get good PHOs, you get a couple of more points than if you only work in metropolitan areas. You do have to have 12 months continuous work in a rural or remote hospital. Things like extra qualifications. So it has changed since my day, but these days people come through with masters quite frequently, so they get quite a few points. If during your medical, some of our JCU guys have done a PhD during their medical degree as well, and that obviously counts. Then you've got things like presentations and publications, and particularly there's some other prizes and awards where if you've presented and got an award or a prize for such a presentation, that might add a little bit more to your application. And the last one is some education and teaching. So if there's any opportunity to teach medical students or fellow colleagues, etc., in a more formal setting, that obviously counts as well. So with all of that, then obviously they usually generally want 6 referees who have worked closely with you. So generally you'd put down something where you've done general surgical terms or at least some surgical terms to give you referees, and then they get sent obviously a report to fill in, and then you interview. If you score high enough with the CV and your referees, then you'll get an interview. This year, they generally interview around 30 a year for between sort of 7 and 10 places. I think there was 9 places for next year. But in general, it obviously changes because some people defer their appointment. Next slide. Other information, this I was gleaned, these are all very generalizations, but it is a little bit costly. I mean, we're jumping way ahead with the fellowship exam of 9,000. You have to get through training to get to your fellowship exam, but obviously the surgical sciences exam, training fees every year, and then also other courses. So there are courses during your training that you have to do, such as CRISP, ASSET. Some of these you can do beforehand if there's space on the programs, but these all cost even a couple of thousand each occasionally, and so it can be a little costly, but obviously we do recoup that back generally with our salary. Sacrifice, I wouldn't say it's a sacrifice. I think it's even during training you get quite it's a great job, and you learn heaps, and generally I think up here in the northern sort of hub we have really good rotations and you have lots of enjoyment doing it. But obviously if you do move around, and so it is a little bit hard to have a base, and especially if you've got a fairly fixed family or something like that, but these things are short term. If you can try and work around them, I think it is worth it, and lots of people do, and probably the trainees are best to talk about most of that, but you do move around in your training every year or every 6 months depending on where you get put. And so that's pretty much the summary of how to sort of the pathway on getting on. And otherwise, if you need more information, which is the next slide, then obviously it's really set out fairly clearly on the website, essentially, where you can tick off what you need. And that's about all.
Great. Thank you so much, Dr. Robson. That was great. If you do have any questions for Dr. Robson, please feel free to add them in the Q&A box and we'll get to them at the end of this webinar. Now I'd like to introduce Cairns Hospital. We've got Dr. Kate Swift, who is a current PHO in general surgery at the Cairns Hospital. We did also have Tiffany Gold, who's a RACS set registrar, but she has just had to rush off to scrub in for surgery.
Hi. Yeah, my name is Kate. I'm one of the general surgery PHOs in Cairns. Tiff apologises that she couldn't make it. She's in something that sounds much more urgent. So I have been a PHO in Cairns for a year and a little bit now. I moved up to Cairns for this job. It's been a really, really good job. I'm sorry that I'll be speaking more from a PHO perspective than from a registrar perspective, but I have seen the registrars circle through as well. Next slide. So Cairns really punches above its weight, I think, for a non-tertiary hospital. It's 530 beds, 10+1 theatres, and has quite a few of the subspecialties. So we have 4 general surgery and 1 vascular surgery team, and they're sort of all mixed general surgeries, but they have, one of the teams has a colorectal focus, one of the teams has a breast focus. We do some endocrine surgery. We all cover the trauma and the ASU roster, and we've recently started doing some upper GI and HPE work as well. And then on the general surgery roster, the PHOs and the registrars also cover vascular in hours and out of hours. And then after hours overnight, we cover urology, max-fax, ENT and plastics. So we get quite good subspecialty exposure here, I think. Next slide. So good things about Cairns. I came here specifically for this job because I had friends who were PHOs here that then successfully got onto the program. I think Cairns has been really supportive of potential trainees. So there are lots of research opportunities, lots of teaching opportunities, the really good boss contact, that the consultants are all very available, never mad if we call them in the middle of the night, always willing to be very supportive. So particularly lots of theatre time, including lots of emergency board operatings, lots of appendixes for a new junior PHO, and good access to elective lists as well. It's a really busy service, so it's very all hands on deck. And the registrars get lots and lots of operating as well, obviously lots of majors, just because it's a high volume unit. Really good research opportunities. There's a Cairns showcase every year that we present audits at. The Hospital Foundation has research grants. Prof DaCosta, who you would have seen in the introduction video, he's very supportive of research and always has data sitting there. So it's been great for even case studies. Patients present quite late in Cairns with quite advanced, exciting pathology. So it's been really good access to publications and posters to bulk up my CV points. And then also Cairns is attached to the JCU medical schools. So they're always looking for more teaching. There's lots of bedside teaching, so it's easy to get teaching points signed off as well. And then of course, Cairns counts as a rural hospital. So that's 12 months of continuous work here is 3 points on a CV, which is maximum rural points. Next slide. Oh, that's terrible formatting on that slide. I'm so sorry. Cairns is beautiful. So I had grown up on the Gold Coast and Brisbane and only moved up here last year, and there is so much to do. You couldn't possibly do it all. There's lots of nature, hikes, waterfalls, beaches. There's just so much to do up here, and quite good social life. Everyone's very friendly in Cairns. It's been a really, really lovely, warm environment to work in, physically warm, but also just everyone's really friendly. So it's been a really lovely hospital to work in and lots to do outside of work as well. That's sort of everything. I hope I've covered the main things. Maybe the only other thing I should say to cover Tiff's input was that there are 4 set registrars here, and they're attached to, one's attached to vascular as a general surgery trainee, and then the other 3 are attached to 3 different general surgical terms, and they're obviously 6 months at a time. And then they cover the on-call roster 1 day a week, and you work about 1 in 4 weekends covering ward round and on-call as well. So the set regs all seem very happy in Cairns. I think that's everything.
Brilliant. Thanks, Kate.
Thank you.
Now can we please welcome Dr. Nestor Sabat, a general surgery registrar at the Mackay Hospital.
In the 5 minutes, the first thing I'd like to say is Mackay Base is we chose it because of the beaches, location, and the wonderful, exciting adventures that we had so far. And a lot of registrars that I spoke to before come up here have a basic, a list of gorges that they try and get to around in the area of Mackay that most people meet, and we go together in groups. They're quite sociable. They do a lot of things together, and over the years we've had a lot of registrars come and go, but nonetheless everybody somehow finds activities that we can do together. And like in Townsville and Cairns, the nature is probably the main attraction, and it's absolutely gorgeous. The Mackay Base Hospital, unlike Cairns and Townsville, I think is a strictly general surgery department, and we have an outreach service to a smaller hospital in Proserpine. We call Townsville for all of our consults, but the interesting thing is you are the first point of call, the first person to assess patients, and you get exposure to a truly general field. You go from ENT, max fax, neurosurgery, you see the patients, you attend the traumas, you assess the patient, stabilize them, and you speak to other tertiary centers and Townsville with regards to support if needed. And then you have an outreach hospital such as Proserpine, where you have days of clinic or one-on-one operating with the consultant. Some of the cases are even majors. If we can go to the next slide, kindly. So in the hospital, we are increasing the amount of urology. We have available 3 urology, 2 are full-time urologists, and 1 is a locum to catch up, as well as an ophthalmology in town, which you can refer to and discuss patients. Otherwise, all the vascular and cardiothoracic and neurosurgery, you get to assess the patient, you get to order the imaging and get everything organized for patients, and then discuss them with the respective specialties up in bigger centers. What this means is that alongside one-on-one with a lot of consultants, you get to be in a high-paced environment, seeing a lot of new things. As a step-up PHO, there's a lot of opportunity to figure out exactly what you want to do in surgery. Some people start off with wanting to do general surgery, then they sort of see a breadth of things. On the flip side of that, you get a lot of skills that I think you wouldn't see in other hospitals, especially if you have subspecialties that need to tick off boxes. Nonetheless, I think our set trainees get a lot of their majors and minors done in our hospital. And with regards to PHOs, that's stepping up and trying to gather everything for their CV. If we can go to the next slide. Yeah, I've seen 5 trainees get onto the program, and all of them commented that Mackay Base Hospital is a really good place to get all the research done and get great referees, because we have a very supportive staff of 4 teams, varying 2 to 3 consultants, all of which round with you on a daily basis, come in with you, help, offer their support, and like Kate said, basically, you perform them in the middle of the night, and they will be more than happy to come in if you are unsure or just need support to doing a procedure, learning a new procedure in the middle of the night. And oftentimes during the day, they walk you through everything. And with regards to the set trainees, I just watch them, teach them step by step all the major procedures. And it's just wonderful to see how much patience and support we have at the Mackay Base. In terms of case studies, I think this year alone, and it's only halfway through the year, from what's been shared with me, the PHOs have published, I think, 6 or 7 so far. And there's lots of audits, apart from the monthly surgical audits, that are available in conjunction with our anesthetics team, as well as the trauma audit and a few colorectal audits that are in the pipeline. So there's lots of opportunity. The data is always available, and Dr. Victoria, our director, is very keen on doing research. just as Kate said as well, we are affiliated with JCU, which is just around the corner, which is great for two reasons. We have a new batch of students who are keen to learn, and oftentimes you get a lot of opportunity to do bedside teaching. And oftentimes you can also go into the school and teach on topics laid out, and there's already a good teaching schedule set up by Dr. Pretorius, which you can take part in. You form your own presentations and you can meet the requirements for the college. As well as a lot of new workshops. Some PHOs in the past have set up whole suturing workshops, currently chest drain workshops. There's a lot of old and new workshops that have been running, coming and going based on what PHOs feel passionate about, what they really enjoy doing. And they always find a consultant or an SMO that is keen on whether it is trauma, whether it is endocrine, or whether it is just basic surgical skills for teaching the medical students. They always find the time to help you set it up, run it, and then you can run it for at least a whole year that you spend at the Mackay base with each round of medical students to come through, which will certainly help your CV. And if we continue. One of the important things, as mentioned previously, is getting through all the requirements, which sometimes requires professional development leave, and getting through your GCSSE. This year and last year, I know for a fact that the department is very supportive in ensuring that you have the support for teaching with consultants, helping you, giving you materials, and also during surgery, quizzing you on things that you may need to know for the GSSE. And we've had, I think, 3 PHOs go down just recently. Actually, this week, they should be done by now, hopefully, writing the exams. And they many of them feel very confident and comfortable because of the support that we have at the base. And last year there was even a study group that was put together by the set trainees that they walked us through all the material and how they did it, which they said that helped their revision for their exams that they have to sit in the next few years, as well as helping us prepare. I haven't heard of any professional development leave being declined, and it's always available to visit conferences. In fact, I think there are 5 set trainees that left for the recent conference, and they said they had a good time just trying to learn and attend, and the department is very supportive of making sure you attend. In terms of surgical skills, personally, I've watched a lot of set trainees say that they don't have to always stay back to get those major minor cases. There's enough opportunity and enough prioritizing by the consultants, and they're very fair. There's enough cases for everybody to go around in terms of elective lists and emergency lists. And I think everybody's very happy this year. And from the ones that got onto the program, they were all able to meet at the base a good portion of their surgical skills that they have to sign off, as well as referees, because as mentioned previously, a lot of them get really involved and you get to know them really well. And if you work hard and show your abilities, I think they're very happy to support you.
That's great. Thanks so much, Nesta. Okay, last to present tonight is Dr. Tony Mallett, who is a Provisional Fellow of General Surgery at the Townsville University Hospital. We also had Dr. Zaim Ahmed, who is a Vascular Academic Registrar. However, he has also just been called into emergency surgery. So over to you, Tony. Thanks.
Hi, everyone. I don't think I put the same work into the slides as everybody else, but we can just go straight on to the next slide. I've worked in all 3 centres, Mackay, Cairns and Townsville, during my training. I've now completed training as of last year. And I guess if we have people looking for PHO positions, really the purpose of coming to those positions is to get onto the program. So if you're looking at these centres as a pathway to getting on the program, what do they offer? One is referees. So if you look at the breakdown of point scoring, referees are still very important, around 30% of the score. And you do need a number of referees, and you do need to move around periodically to actually have access to more referees. The advantage of all of these centres is that you have much closer, you work more closely generally with the consultants than you do in the larger centres around the southeast corner. So the consultants will know you very quickly. They'll know you by name and you'll be with them all the time. So they will get to see what you can do in terms of, not just in terms of operating, but in terms of on the ground patient assessments, et cetera, et cetera. So you have people who actually know you well and can and know what is required from referees to make you eligible really for getting onto the program. So in all three centres, you have good, close contact with consultants and regular consultant feedback as well. The second thing in terms of scoring will be your CV. So if you look at the point scoring now, you get up to 3 points. We get 3 points for 12 months in a rural or remote location. And if you have a look in the appendix at the back, then all three of these centres qualify for that. So we've found that there's actually an increasing interest and increasing number of PHOs coming up from the southeast corner, certainly to Townsville. And I think part of their motivation is those 3 points. So we do see people coming up for 12 months. That gives you access to your referees. That gives you 3 points for your CV. And that's the same for all of these centres. The other advantage you have is the on-campus uni that we have here. And they have similar setups in Cairns and Mackay where you have students, and then you do have access to teaching, and there is points allocation for that in the CV section as well. So that's very difficult exposure to get in the bigger centres in Brisbane. So in terms of referees, in terms of CVs, there is an advantage up here. The other advantage you'll see is in terms of the experience you get. Certainly in the tertiary hospitals in Brisbane, you'll have consultants, fellows, registrars, and then PHOs. So there's that many levels between you and the consultant, one, and then two, there's that many levels between you and clinical experience and surgical experience as well. So when you're looking at applications, you'll want to be fairly independent with removing an appendix as part of their criteria, I think. So just to give you a gauge, in my first 12 months as a PHO in southeast Queensland, I probably did about 10 to 15 appendicectomies. In my first year in Cairns, it was probably around 50. My second year in Cairns, it was probably around 100. So you do get a much higher level of sort of hands-on experience in these locations. So there's a lot of good reasons to look at these hospitals seriously for a PHO position. The other thing you need to do to get on is pass the GSSC. And if you're a resident, that is probably the best time to be studying for it and passing it, because your free time does evaporate once you're a PHO. Increasingly in the southeast corner, passing the exam is one of the criteria about getting a PHO job or not. So, and that's probably going to start to come in around Townsville as well. That these places are becoming increasingly desirable. So where there's competition, then what you need to do to get the position it does get more difficult. I can tell you in all three places, you've got nice people to work with. You've got good consultants in all three places that will help you and support you. And I don't think anyone would really have a negative experience in terms of the units themselves or the support that's offered. Can you just go to the next slide? So Townsville, we had all those subspecialties that I've mentioned. So Townsville really is a tertiary hospital in the north. The only services we don't really have is transplant and burns. There's a colorectal unit here now with 3 consultants that gets through roughly 150 colon resections a year. There's a upper GI unit, hepatobiliary unit, and again, we take from the Mackay and Cairns catchments for complex cases in those subspecialties. And breast and endocrine, and we have now an oncoplastic service, so we are starting to do some reconstruction work in Townsville. Some of it still goes to Brisbane. In terms of the subspecialties, ENT, Max Fax, neurosurgery, all completely independent of general surgery here. The only units we cover, apart from general surgery, is urology and pediatric surgery after hours. As part of the PHO allocations up here, you do get rotated through ICU as one of the terms, which can be helpful for applications depending on what you want to do. You do rotate through urology. So if you had an interest in urology, you could request rotation there as well. And we also rotate through pediatric surgery, so the same applies for that. There is also one position at the MARTA which rotates through, I think, every 10 or 12 weeks. The way Townsville itself is set up is we've got now full staffing of 12 consultants. I'm the fellow here. We have 5 training registrars, and that's essentially how the units are broken up. All the training registrars essentially have a PHO with them, and in a 3-month term, we try to keep the terms longer. So a 3-month term, you'll be essentially working side by side with your registrar, so you can see that kind of next step up. And there's lots of PHOs. You can see 15, and that accounts for nights, leave, covering subspecialties, and the ICU and the MARTA term as well. And obviously stacks of residents to go with that. So in short, I mean, all 3 centres offer some advantages that you may not have in other locations, particularly around Brisbane. All 3 centres, you will, there aren't hostile personalities. You have, quite well-functioning units, and all of them you'll get more exposure than you would in sort of larger centres as well. I think that was my only slide.
Great, thanks so much, Tony.
Thanks.
And thanks, everyone. I'm getting feedback. Can other people hear that? No? Okay. Thanks, everyone, for your excellent presentations. We are now opening the conversation to questions from our audience. We've also received a few questions through the webinar registration page, so we'll try to answer all of the questions tonight, but if we can't, we will answer them after the webinar. Like I said, at the bottom of the screen, you can see the Q&A icon, so feel free to use this to ask any questions that you might have. Okay, I might just start with some of the ones that we've previously received. So the first question is, I am an IMG with about 4 years of training as a general surgery resident and eligible for provisional registration along with full working rights in Australia. Am I eligible for the RMO general surgery position? What is the best course of action for people in my situation to pursue their career in general surgery? Thank you. Who'd like to take that question?
I suppose, I mean, the main hurdle is they have to either be a permanent resident or citizen. So there are, we have quite a few IMGs, but they do need their permanent residency. While waiting for that, that doesn't stop them applying for PHO jobs, getting their experience, ticking the boxes for all the selection criteria, essentially, so that when they get that, when they get their general registration and get their permanent residency, they have everything ready to go, essentially. So, I mean, they can still apply for the PHO jobs in general surgery to start, getting their general surgical terms, getting their experience up. But unfortunately, the biggest hurdle for a internet, IMG is the fact they just need general registration and being a permanent resident.
Great, thanks, Angela. We have another question. It says, if I'm interested in cardiothoracic surgery, which hospitals in the North Queensland region provide the training and how long will the training be?
So sorry, what was the start of that question? I missed it again, sorry.
That's
That's all right.
Cardiothoracic surgery, Dr. Robson. So cardiothoracic is only at Townsville Hospital. It is not a discipline of general surgery. So it's a separate college. So you need to look through the college for cardiothoracic surgery. Dr. Julie Mundy at the Princess Alexandra Hospital is probably the best contact in terms of cardiothoracics program.
Thanks, Tony. And also for that question, if you look on the NQRTH website, it will actually tell you how much training you can do at Townsville University Hospital and then how much training you can do at the other hospitals. As what Tony just said, if you speak to that person at the PAH, and they can also give you some more information. Another question is, how hard is it to obtain a Gen Surg training position in North Queensland, or how competitive is it?
Well, I mean, it depends. So basically for general surgery, the actual college, getting on the program, you sort of, it's an all Queensland. So, and then you sort of put your preference as to what sort of hub. I think, Tony, you actually were the North Queensland hub, I think, weren't you, from memory?
Yes, Robson. Thank you. Was my consultant when I first landed in Cairns.
Yes. I gave you all those hundreds of appendixes. You sort of, it's not like getting on to, like, you don't sort of get onto the North Queensland bit, you sort of get onto the whole bit and then asked to be sort of more North Queensland based. You still will rotate through the southern of the state because it's the breadth of experience. So as much as Townsville has a lot of everything, it still isn't like, there's still good rotations to do in the southeast corner, but you can preference a lot of the northern of the state. So you sort of, how hard is it to get on? Maybe if Tiffany was on or Kate's trying to get on, people do have a few goes. It's all about maximizing your points. Unfortunately, it is highly competitive, any position. So you really have to try and maximize those points as much as possible.
Right. Okay. The next question, the person hasn't said whether or not they're an Australian permanent resident, but the question is, for people who have had general surgery experience outside of Australia as an IMG, would this experience be considered towards the points on the CV, or does the clinical surgery experience have to be in Australia?
That's a hard one. That'd be something you'd probably have to email separately to the college. If it was recent, and it depends where. So, but a lot of it would probably have to be in Australia, to be honest.
Okay, and would a few doctors like to describe the working hours and the salary, and how much does the salary jump from when you're a resident into a registrar position? Anyone knows off the top of their head?
If I'm not mistaken, all that's public information online. But the working hours are as much as I think when we discussed it with our colleagues, the working hours is as much you put in as what you get out. So I think most of us don't really think of working hours. It's more you're there to get the job done because you're there for the patients. I think it also depends on which rotation you're on. If you're on a reliever, or if you're on nights, or if you're on call, or if you're part of a team, especially Mackay base. I think there's a lot of support to try and get all the work done in hours, but some of us PHOs, we prefer to stay back because then we get opportunities to operate in CQOL cases and perhaps get engaged, because Yeah, there's a few of us that yeah, that question has been discussed, but I think the hours are as much as they're reasonable in terms of they give you a slot, but I think most of us stay back because it's what we will sort of enjoy doing and we forget the time. But if there's a lot of people that also have commitments outside of work and they're able to meet all of them, and some of us want to pick up and do extra operating time, we're able to do that, and some people who have commitments are able to do that as well. And I think that's part of the um, a good thing about having a good group of PHOs and registrars that are willing to work together. What do you think, Kate?
Yeah, similar experience. I think if, I guess you're not picking it for excellent hours, surgery is always going to be long hours. That's why it's cool. But I think we have our roster pretty much, you end up with a 10 weeks of nights rotation. That's an 8 p.m. to 8 a.m. and that's pretty reliably go home on time. And there's a 10-week term of admitting shifts that's Thursday to Sunday, that's the 10 to 12 hour shifts. And then otherwise for the rest of the year, you're on a Monday to Friday roster, which is usually relatively long hours. I think it's somewhat frowned upon to sneak out on time. But I think you're compensated for the hours that you work, either like overtime is appropriately paid. And I think that the time that you're staying back, sometimes you're just doing it because there's something cool happening. And most of the cool stuff, just Murphy's Law, happens after hours. So, but I think that it's hard work. I think it shows the people who stay late and stay back, and there's always more work than there are people. But I think we work when we're on one of the normal Monday to Friday teams, we work every fourth weekend, we do the entire weekend. And then every second weekend, we just do a weekend ward round as well. And then Monday to Friday is usually sort of a 7 a.m. till 5 or 6 p.m. job. As a guess.
Yeah, you'll find that pretty well the same in all centres across Australia, I'd imagine. Typical working day between 7-ish and anywhere between 5 and whatever hour of the night. If long hours are a problem, then probably look for a different career, really. And like the others were saying, all three centres, there's no problems like there have been in other centres with payment of overtime. I mean, it's been some time since I've worked in the other centres, but generally speaking, so I think the second part of the question was about money, and I wonder if the first part related to that, because you won't be strapped for money as a surgical PHR or a surgical registrar. You will happily trade money for free time, and I can see Dr. Robson nodding as well. Money will not be a problem, and pretty well no matter what you're going to do with your career, so don't pick surgery for money either. You're not going to have to worry too much about where your next dollar is coming from. But surgery in particular will be paid a lot more than most of the others just because of the hours that we do and then the penalties that you accrue based on that. So lots of hours, lots of cash to go with it, if that answers the question.
Thank you to everyone. This question says, I have heard mixed things about the critical care requirement for the general surgery CV. Does this include ED and ASU, or does it have to be a specific crit care ICU rotation?
I can probably answer that one. It's on there's a PDF that just has all the application to the program requirements, and they list the terms that they consider to be a crit care term. But ASU, there's a long list of them, but ASU or trauma, ED, ICU, HDU, burns, I think transplant counts as a crit care term as well. So there's a long list of them. It doesn't have to be a surgical term, and you can even have done it in your intern year. It just has to be within 5 years of your application for it to count. And it just has to be 8 weeks long. So everyone technically probably meets the requirements because you have to do 10 weeks of ED as an intern and you're allowed to count that term. But most of us will accidentally get another crit care term. Vascular counts as well, but it doesn't have to be surgical.
Brilliant, thanks, Kate. And is anyone aware of the support structure that is in place for Aboriginal and Torres Strait Islander residents who would like to get onto the training program?
that is probably all. Also, I mean, the college has a plethora of information on the website and you can get a bit lost in it, but they are obviously encouraging to do so. Unfortunately, they still, though there's no reduction in criteria, they all sit the same criteria, but there will be other supports in general from the college around that.
Yes, thanks, Angela. That's brilliant. Okay, here's a question. Are there any tips or resource recommendations from the PHOs or registrars on passing the GSSE?
Memorize the bank. They accidentally repeat the questions every year. They can't seem to think of new questions. There is the 3 Excel spreadsheets rotating around for the 3 different exams. And in my year, I think 10 questions per subgroup of exam came up again. Exactly the same questions, same order of the answers. Memorize the bank and then read around the questions in that. And then the resources on top of that, I think for anatomy, it's Lasts or it's Instant Anatomy online is really good. And then for pathology, I don't think there's any one. The mini Robbins is really good because the big Robbins is way too many words. And then for physiology, I read Ganong's and that was okay. But most of it is just, if you do the practice questions and do the, Professor Mundy has her practice exam that you can sign up for. And that's really good. She mediates it online and keeps tabs of how people do after her practice exam. So that's also really good. And then you just read up around the practice questions that you do and just generally practice. But the bank is really good. And the spotter questions, they use the exact same pictures from, what's the atlas that they use it from?
Rohan's Atlas. Yeah, and I think that just note that this year they've increased. Officially last year, the college had first 10 chapters of Robinson Contrans for the GSSE. This year, I think they've extended to the whole book. And I think in addition to Ganong's, everybody recommends West's for respiratory physiology because that chapter in particular people find hard to understand from Ganong's. And West's is 102 or 105 pages, which lays it out quite beautifully. And then there's packages of summaries going around for Last Anatomy that can help and spotter questions. And online, you can even buy flashcards specifically for Rohin's, because oftentimes those images and specifically a lot of the questions come from a lot of things that are recycled or looked at from Rohin's, although not always specific, because there are 3 or 4 part questions that rely on you identifying the specific anatomy, and then specific physiology and pathology related to that anatomy will be the subsequent questions. And decide if you want to study alone or a partner. 6-month period is the recommended time minimum, unless you're really good at cramming. But 12-month course of learning everything is also recommended, but 6 months at least of continuous studying is required by most people that I've spoken to.
And did you say, Tony, or was it you, Nesta, that you can complete the GSSE in your resident years?
I think that's, yes, I think that Dr. Mallet mentioned that resident years, you have a lot more time as a PHO. To say that I'm going to have 40 or 50 hours a week is very unpredictable, because if you have cool cases, oftentimes you find yourself in the OR trying to see them instead of cramming, which is difficult. But at the same time, in the resident years, you just have more days off, I think, in many of these sites, because your roster is finite hours, and you can actually get it done. And some of the tertiary centers are even, I think around here, they prefer that you have the exam. And it's really good to have it, because when you're in the operating room, you tend to understand more of what's going on when you've sat it.
Yeah, I think passing or how to sit the GSSE is a topic on its own that you could spend an hour forum on. Probably the best thing to do would be you just need to approach one of the PHOs or registrars where you work. Pick someone who's just passed the exam, tell them how wonderful and amazing they are, and then ask them how they did it and what their resources were. And people will be very happy to share with you, and that'll be the best way.
But in also saying that, like, it is probably better now to start doing it when you are a resident, because we are, especially up here, because we get so many points now and all these sites for coming, you know, people want to come as a PHO to get their points and to get the experience up here, that we actually have our pick of PHOs. And basically, if you're all the same, if you've got the exam, it means you've got the exam and we don't have to give you time off to do the exam. And so, you know, that might get you a better job as well. So I'd do it as early as possible if you really want to do surgery and get it out of the way.
Great advice. Okay, well, that's all the questions that we do have. Would anyone on the panel like to offer anything else before we wrap it up? Oh, okay, great. So thank you for all those great questions and answers from our panelists. There were a couple of questions that were quite similar to the ones that have already been asked, so I'll answer them separately after this webinar. I would like to say a big thank you to each of our panelists for your time and the valuable information provided about general surgery training. A big thanks to our audience for your time and great questions. This webinar has been recorded and you will receive an email soon from us with a link to this recording. Thank you everyone for tonight and have a great week. Bye.